Greetings, everyone. I'm Congresswoman Yvette D. Clarke, chair of the Congressional Black Caucus and proud representative of New York's 9th District in the United States Congress, covering Central and Southwest Brooklyn. I want to thank my colleagues of the CBC representing the Committee on Veterans Affairs and Armed Services for their leadership and presence this afternoon. The Congressional Black Caucus has gathered today to express our grave concerns about the incredibly disturbing treatment America's veterans have received on the orders of Donald Trump and his billionaire sidekick, Elon Musk. As we are each painfully aware, in just a few short months under this administration, thousands of veterans have already lost their jobs. Thousands more have lost their access to the VA system of health care and benefits, or at risk of losing it. The medical research they rely on just to survive has been decimated, and the looming cuts to food stamps, SNAP benefits, and Medicaid will increase food insecurity and make health care inaccessible to them and their families. And while I'm infuriated by the callous and destructive endeavors of this administration, above all, it is their cruel indifference to the consequences of their actions that fuels my absolute indignation at this moment. Because let's be clear and let's be real. Our veterans risk their bodies, their minds, their spirits, their futures, and their lives for our nation. Our veterans swore to serve America, and America swore to take care of them when that service ended. Due to Donald Trump and Elon Musk, that promise has been broken. And this total betrayal we are witnessing is all the gratitude this pitiful administration can muster. And now, because of Donald Trump and Elon Musk's action, veterans have become the face of this administration's cuts. Well, let me just say this to Mr. Trump and Mr. Musk. Our veterans are not a waste. They are heroes. They deserve to be respected. They deserve to be protected. Since day one of this administration, these despicable men have shown the American people who they are and who they are working for. It's clear to each of us here today, just as it's clear to folks in every corner of our country, that they're not working for the American people. They're not working for the more than 16 million veterans across our nation, 2 million of whom are Black men and women. They're not working to build a better nation that has a better future. They're only working for themselves and the billionaires that they serve. And tragically, our veterans have just been caught in the crosshairs. I believe I speak for my colleagues at my side today when I say veterans deserve better than what this administration has done to them. And so we stand for our veterans, those who have put life and limb on the line, who have put their soul, their body and soul into the protection of our Constitution, our people, and our nation. And we stand here to express our gratitude for their sacrifice. With that, please allow me to introduce my colleague and my dear friend, the gentle lady from Fort Lauderdale, Florida, Congresswoman Sheila Surface McCormick.
Well, good afternoon, everyone. I'm Congresswoman Sheila Surface McCormick, and I want to start off by thanking our gracious chairwoman for the Congressional Black Caucus for bringing us here today so we could talk about an issue that affects all of us, which is our veterans. Our veterans have sacrificed their life. We have an American contract with them that says that we will take care of them. When they signed up to protect our country, our way of life, we promised them that we would take care of them and their family. What we're doing right now by cutting over 800,000 80,000 or 80,000 veterans from actually working for the VA. What we're doing by defunding the PACT Act is actually hurting all of our veterans and attacking our veterans. Let's talk about the PACT Act for a minute. We have helped so many veterans who were exposed to toxic materials actually have a chance at getting benefits. But let's talk about this exposure and how it happened. Some of our veterans went to war and they were exposed, and we have a promise to take care of them. But we don't often talk about our soldiers who were exposed on their bases. Yesterday, I spoke to several veterans who talked about being exposed to toxin on the base in Red Hill. In Red Hill, we had more than 93,000 veterans who were exposed to toxins in their water, in their pipes, in their everyday materials. They were exposed to that. In addition to our veterans being exposed, we had their children who were exposed. We had so many women who were pregnant who lost their children because they were exposed. What do we do now? We say that we're not even allowing them to get benefits so we can actually help them. Our government poisoned these people, and this is the time where the Republican thinks that we need to sacrifice our veterans who have sacrificed for us by cutting the funding to help them. Absolutely not. This is a breach of confidence. This is a breach of their contract, but more importantly, it's repulsive that they think the best way to go about this is to sacrifice our most vulnerable. If you want to find money, let's go look at the billionaires. Let's go look at their investments. We're hearing a lot about this conversation about taking the medicine. Well, why do the veterans have to take the medicine when they sacrifice so much? Why is it that the billionaires don't have to take the medicine? I don't see Elon Musk taking any medicine. If anything, he's trying to stop it. But he looks at us and tells us to take the medicine. We can't stand for this, especially when it comes to our black men and our black women. When we look at our women, they are 4 times more likely to have breast cancer than regular women. When we look at black women who serve in the military, the numbers are astronomical. Ask yourself, how does that happen? Is there a correlation with their service? Of course there is. And so for us to stand and act like we're not poisoning them and we don't have a responsibility to protect them is utterly ridiculous. There are better ways to go about this, and we cannot stand by and let our veterans be the sacrificial lambs. Not today and not tomorrow. And so I'm proud to stand here with our Black Congressional Caucus to actually bring our voices to this. But what we're really doing is bringing awareness. Bringing awareness to this time that we're living in, where we have Republicans who are cowering over, saying nothing. These are the people who say they love veterans, that they are veterans. So why is it now that you're spineless and you're allowing us to actually attack our veterans? We need to hold everyone to task, and everyone must actually fight back and not allow these cuts. Finally, I'd like to introduce one of our Congressional Black Caucus members, our newest member, Herb Conaway, who serves on Veteran Affairs with me.
Thank you. Thank you. My name is Herb Conaway. I serve New Jersey's 3rd District, and I stand before you as an Air Force veteran who is taking care of veterans at the Walson, then Army Hospital, Air Force Hospital, and I served on the base. I am a practicing physician, and so I know something about the experience of veterans. I took care of them in my community and on the base where I served. I now serve on the Veterans Affairs Committee, and we've heard testimony from so many veterans who've come before us with concerns and really desperate to ensure that their fellow veterans get the care that they deserve. When a person stands up for our country and says, I will serve, even if it means the sacrifice of my own life for our American values, and the contract we make with them, the promise that we make to our veterans, that if you are killed in the line of action or killed during training, that we will take care of your family. If you go to war and you're injured, if you're in training and you're injured, if you're fighting on behalf of our country, then we will take care of you and restore you to your health, whether it's your physical health or your mental health. And we have heard over and over again that promise has been broken. And we are seeing right before our very eyes with this administration, where you're talking about 80,000 people who are being discharged from service in the VA, people who themselves are public servants. And many of those public servants are veterans themselves. They are retirees, about 30% of them who understand what it is to serve in the military, what they understand what it means to try to fight for your disability benefits. They understand what it means to serve. And we're discharging these people at the time, and the PACT Act has been mentioned here, when we have said to veterans rightly that if you're exposed to toxins in the battlefield, or you're exposed to toxins indeed as part on your own base, that we will take care of that issue for you. We will monitor what's going on. We will recognize our responsibility to address that issue, to address the issue of toxic exposure. So what has the administration done? It's supposed to prepay some $22 billion into the VA to take care of the almost 800,000 veterans who now have benefits or access to benefits in the VA. Now we're told that we can cut all of these people from the VA. We're not going to fund to the tune of billions of dollars to care for their service, and that everything is going to be all right. That these cuts aren't going to have any impact. What does the evidence show? That a veteran in a veterans hospital has a better outcome when they're being served within the VA system itself. This has been proven. And remember, if we take down that system, many physicians such as myself, some 70% of the physicians working today, practice and learn their trade at a VA center. The VA is responsible for many advances in healthcare that are serving not only veterans, but for the public at large. And if we have a pandemic, if there is some new outbreak, the Veterans Administrations and their offices serve as surge capacity for the many people who might be impacted by something like COVID. So we are making a mistake. We're breaking a trust, and we stand here with my colleagues to say that we're going to try to hold this administration to account. And I'm going to end with this. We're seeing this very thing right straight across the government. All that's being done right now is in the service of making the billionaire class even richer. Their plan is to show that the government doesn't work. We're seeing this in Social Security, and so what? They can privatize these services, and they themselves and the billionaire buddy club can go in here and try to provide these services. That's what this is all about. This is about saying that workers don't count, that the care you bring to veterans we're going to disregard, and we're going to sell government billions to a billionaire. We're going to privatize services. That's what all of this is about, folks. So we're going to say no. We're going to hold them account. We're going to fight. We're going to need all of you to get out in the streets, to do the protests you need to do, and to make sure that these disastrous cuts that are harming our veterans do not stand. Who am I supposed to introduce? You got it?
You can turn it back to me, and let me.
Chairwoman,
let me
run this thing.
Let me thank Congressman Herb Conway for really putting this in perspective as someone who is deeply embedded and deeply intimate, has an intimate knowledge of what is happening to our veterans and what these cuts to veterans benefits and to the VA actually means in real time. I want to acknowledge that we are joined by Nakima Williams of Georgia, as well as Al Green of Texas, and ask Al if he'd like to make a few comments at this time.
Thank you very much, Madam Chair and members. I especially thank the chairwoman because she has given us visionary leadership. She has made a difference in the lives of people since her arrival in Congress, and she will continue to do so. I'd like to share a brief vignette with you. I was lost in a state that I was not familiar with, and as I looked over my right shoulder for some sense of direction, if you will, I saw a sign. And the language on the sign read, "Come in and see the price of freedom." Come in and see the price of freedom. It was not a bank. It was not Fort Knox. It was a VA hospital. If you want to see the price of freedom, visit a VA hospital. See the people who have lost their limbs, who have lost their vision. See the people who are willing to make the ultimate sacrifice so that they could protect liberty and justice for all. Government of the people, by the people, for the people. Go to a VA hospital. And I want you to know that while the VA hospital is a place that we should focus on, we also should remember that a good many of those veterans have jobs working in the Postal Service, a good many of them. And when you start cutting willy-nilly, arbitrarily, and capriciously, you're going to injure veterans, people who are willing to sacrifice their lives. So, Madam Chair, I thank you for what you're doing. You will make a difference in the lives of those veterans. And I just pray that those veterans who are among the ranks of my Republican brothers and sisters, that they will have the courage, the intestinal fortitude, to put it in the words of Malcolm X, that they will have the chitlins to stand up to Donald Trump.
Thank you. Thank you very much, Congressman Green. Are there any questions? Well, thank you for joining us today, and enjoy the rest of the day.
Thank you all.
Thank you.